Medical devices, biometric monitoring devices, Lesson 2, Electrocardiogram, ECG. This unit covers the basics of medical devices. The goal for this lesson is to understand the role of the electrocardiogram and learn about how to correctly apply electrodes. This is the content of this lesson. The electrocardiogram can obtain the data of the most important vital sign, displaying the action potential of the atria and ventricles as waveforms via electrodes. The P wave represents atrial depolarization. The QRS wave represents ventricular depolarization. And the T wave represents ventricular repolarization. Abnormalities in the P wave suggest suspicious atrial lesions, and abnormalities in the QRS to T waves suggest suspicious ventricular lesions. The role of an ECG monitor is the early detection of abnormal heart rate, arrhythmia, and myocardial ischemia. There are two types of ECG leads, limb leads and chest leads. Limb leads are the most commonly used leads where 3 electrodes are applied on both hands and feet to view the heart. 3 bipolar leads and 3 unipolar limb leads can be observed in these leads. For chest leads, 6 electrodes are placed along the left intercostal margin from the sternum to view the heart potential from each position. Thus, 6 potentials can be observed. Since 12 potentials can be observed from these two types of leads, they are called the standard 12-lead ECG. Since the ECG amplifies a weak potential, the noise affects the measurement accuracy of ECG. To prevent noise, it is important to place the electrodes in the correct position and lower the resistance between the electrode and the skin. To lower the resistance, use new electrodes and place them on clean skin that is free of sebum, dirt, and dryness. In addition, avoid wrinkles to ensure a wider contact area. To prevent electromyography from being detected, the electrode should be placed at a position where there is less muscle. If T wave is double counted, the electrode position should be changed. This is the end of Lesson 2, Electrocardiogram, ECG. Make sure you've mastered the basic concepts before you move on to the next level.